Sometimes if the sweating is excessive and more localized to the upper part of the body or the lower part of the body, then this can indicate a localized dysfunction or hyperactivity of one of the parts of the nervous system. Welcome back. Thank you so much for all your comments and feedback with all my videos there. I'm just going to focus on a couple of questions which I thought were quite interesting and probably worth using this video to talk about. So Ruby talks about the diagnosis of fibromyalgia for quite a long time, and her main problem is the sweating that's happened there day and night, a constant feature. Now this is something I hear a lot of my patients mention as well, especially if ladies are between the age group of 35 to 55, where you start having that perimenopausal / other conditions in place. Then these can often be differential diagnoses. So Ruby says that obviously endocrine function has been looked at, thyroid function has been looked at, and even the menopause related symptoms or levels have been looked at, which is all good. And the question therefore is, what can be done for the hot sweats? Now this is something that can be managed at multiple levels. Often from a perspective of medication, if sweating is a significant issue and that is the only primary symptom, then there is a role for drugs such as propanthyline. So that's one kind of medication that reduces the sweating. Then there are other drugs like glycopyrrolate. So these are all names that might be worth discussing with your specialist who's looking after you, or your general practitioner in whichever country you are. So drugs like propanthyline, glycopyrrolate, oxybutynin. So these are all names that are options to think about when sweating is a major problem. Sometimes if the sweating is excessive and more localized to the upper part of the body or the lower part of the body, then this can indicate a localized dysfunction or hyperactivity of one of the parts of the nervous system called the autonomic nervous system. So that means that that particular system, which is going hyperactive and haywire, can lose control of the function of how the blood vessels open and close in a particular part of the body. And as we know, sweating often means that the signaling to a particular set of nerves and the blood vessels has gone a little haywire. That means more blood flow occurs to the upper part of the body or the lower part of the body, and that is manifested as sweating because of a loss of temperature control. In such a situation, if this is one half of the body that is more specifically affected, then there may even be the role for interventions like a sympathetic nerve block. This is again something that can be discussed with a pain physician or a surgeon depending on which part of the body is blocked there, but that could be an interventional sort of option for the sweating. There are certain options. Now Ruby talks about sort of a vegan diet in the context of fibromyalgia. Now there may be an option to actually get a discussion with a nutrition and a nutrition specialist to see whether there could be some foods that could be contributing to it, or some combination of meal plans or times of eating that may also be contributory. Now I know the evidence for this is probably less than satisfactory in this area there, but I certainly would encourage you to explore options around intermittent fasting or even the role of a fasting mimicking diet to probably see if you can look at that as a way of managing nutrition if sweating is occurring because of a food related reaction. That is probably what I have to say about sweating in the context of a ruled out endocrine function, or for that matter any thyroid anomaly or menopause related. I hope that's helpful for you, Ruby. Thank you for watching the videos. I hope you're getting value from them. Don't forget to subscribe and hit the bell button for notifications on when the next videos are to be released.